Hello nurses and hello world, this is nurseniezl and welcome back to my channel. Is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's website. Subtle similitude may be noticeable. However, this is not intended to be definitive guide to the NMC Part 2 test of competence or the Osce examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. And you are right, according to the thumbnail of this video, I am going to show you how to write an evidence-based practice with the topic of diabetes. But before we get into it, I would like to ask you to please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. Oh yeah, can I just remind everybody that if you click the join button and become a member, if you got a question for me, that question will be pop up to the top and I'll be able to answer your question as soon as I can, okay? As soon as I can because life is busy at the moment. And that's part of your perks as a member. Also, as a member, you will be able to see them videos before anyone else, okay? That's part of your perks. And there are videos in the playlist that only exclusive to the members. So please click the join button and enjoy those videos. So before we head into the answers of how we're going to write this evidence-based practice regarding diabetes, let's first learn what diabetes is. Diabetes is a condition that causes a person's blood sugar level to become too high. There are two main types of diabetes. Type 1 diabetes is a lifelong condition where the body's immune system attacks and destroys the cells that produce insulin. On the other hand, type 2 diabetes is where the body does not produce enough insulin or the body's cells do not react to insulin properly. Type 2 diabetes is far more common than type 1. In the UK, over 90% of all adults with diabetes have type 2. High blood sugar develops during pregnancy is known as gestational diabetes. It usually goes away after giving birth. Many people have type 2 diabetes without realizing. This is because they may not always notice any symptoms. So what are the symptoms of type 2 diabetes? Urinating more than usual. Feeling thirsty all the time. Feeling very tired. Losing weight without trying to. Itching around the penis or vagina or repeatedly getting thrush. Cuts or wounds taking longer to heal. And blurred vision. Now for the symptoms of hypoglycemia, in which the blood sugar is low. Feeling hungry. Feeling dizzy. Feeling anxious or irritable. Sweating. Shaking. Tingling of the lips. Heart palpitations. Feeling tired or weak, changes in the vision such as blurred vision, and feeling confused. According to the NHS, it is a medical emergency and you have to call 999 if you think someone has very low blood sugar and they're not responding normally or they're unconscious and a glucagon injection is not available or you do not know how to use it. You've been given a glucagon injection and they have not responded or recovered within 10 minutes, or they have been drinking alcohol. So evidence-based practice is a silent or a writing station. You will be given 10 minutes to write in silence. So you have to finish all the writing within 10 minutes. But nurses, the question here is, how are we going to write this? Don't worry, because during your exam, you will be given a scenario, a lengthy one, in which you have to read that research. That research contains the answer of what you need to write. Also, let me introduce you to the marking criteria. This one right here. So this marking criteria will guide you what to write on your exam. But there's just too many. Also, I need you nurses to take note that it's not just one evidence-based practice. There's this evidence-based practice, not to mention this professional values, plus the 21 skills and the API and everything else. There's a lot going on. So I know that's why you're here watching this video. I know you're waiting for me to show you and help you how to write your evidence-based practice when it comes to diabetes. Yes, there is a way for you to be able to memorize this by just highlighting the keywords. That's correct. So these keywords will break down this marking criteria into a more memorable words for you to bring on your Osce exam. Yes, you are already equipped with the answer before you even get there. Are you ready, nurses? Yes. Okay, let's go. But first, let's take a look at the scenario. So you will be given a lengthy scenario from the exam that revolves around something like this. So again, the scenario goes like you are the nurse taking care of the patient who happens to be diagnosed with diabetes and now on a tablet at the same time. However, your patient now is concerned about the occurrence of hypoglycemia. So she's asking you now what she should do when her blood sugar drops. So again, nurses, how are we going to write the answer for this? That's why there's research, okay? So don't worry. The research, you will get your answer from the research, which sort of like this. And you have the marking criteria to guide you, this one's, to guide you what to say or what to write on your exam. So when you are writing this evidence-based practice, it's as if you are talking to your patient, advising your patient what to do in case her blood sugar drops. Now, let's start highlighting the keywords. So from this scenario to this marking criteria, let's start with the first one, shall we? Nurses, you have to know that you need to summarize the findings of the article summary and draw your conclusion, making sure to make some recommendation. And now, because your patient is asking you what to do just in case she suffers a drop of her blood sugar or suffers a hypoglycemia. So let's break down the marking criteria, shall we? The first one is this. So you can say, you can highlight the word less likely to suffer hypoglycemia. Those are the keywords in the first bullet. And yes, you can just add other words in here from your research, okay? From the research that's given to you on your exam, okay? Yeah, because you need to explain that your patient is less likely to have hypoglycemia because your patient is not prescribed with insulin, okay? So yeah, what about the next one? Yes, you can highlight this word, hypoglycemic plus diet-related factors. Yes, definitely. Because according to the research, in accordance to your marking criteria, hypoglycemia is often caused by diet-related factors. That is true, and that's according to the research, okay? How about the next one? Yes, symptoms of hypoglycemia, of course. Definitely, okay? Because you have to make sure to mention there, make sure you include there the symptoms now. All the symptoms, name the symptoms. I'm just highlighting the word symptoms, but you have to make sure to write all the named symptoms from the marking criteria, which are the following: excessive sweating, feeling faint, lightheaded, blurry vision, new confusion, and or nausea. And also, I would like you to highlight the word 999 in there. Okay, so symptoms, 999. How about the next one? Yes, family and friends. Highlight the words family and friends, and of course 999 in there. Family and friends, 999. Because if you are a diabetic, or in this case, if your patient is diabetic, you need to make sure that you advise your patient to mention to their family and friends that if they have this episode, they need to call 999 immediately. Okay? So if they have the symptoms that we've just stated a while ago, they need to call 999 because this is an emergency. Alright? So again, family and friends, 999. Highlight them words. Okay, the last one would be, yes, monitoring more frequently. So that is the keyword in here, in which will remind you, because you need to advise your patient that she needs to monitor her blood sugar more frequently or more often. Okay? Because this acute illness will cause irregularity. So make sure that make sure that you advise your patient that, okay, to monitor more frequently. So that's it. We've just finished highlighting the keywords. Now I'm gonna give you 10 minutes. You need to pause this video and just come back and write your answer, okay? You've learned now the highlighted keywords that you need to use for your exam. So use this video as a practice. Time yourself for 10 minutes, pause this video, and then just come back. Your time starts now. Hello, you're back too soon. Yes, I know that you're watching this video because you wanted to know my answer. Again, a disclaimer, this is just my answers. I'm not saying that they are correct. I'm not saying I will pass the exam if I take the exam right now and write these answers of mine. However, I've done my research and these are all my opinion. You are entitled to your own opinion and you can also do your own research, okay? Again, nurses, please do read and find some research regarding diabetes, okay? Yeah? Again, before I give you my answers, I would like to ask you to please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. And if you got a question for me and you want your question to be popped to the top and I'll be able to see it immediately and reply as soon as I can, then hit the join button and become a member. As a member, you are entitled to some of the videos that are only exclusive for the members and you will be able to see the videos first before anybody else, and that's part of your perks. These are now the answers. Enjoy! I will tell the patient that she is likely to suffer hypoglycemia as she is not prescribed with insulin. Furthermore, I will inform her that hypoglycemia remains a serious concern and she should be vigilant to check her blood glucose levels and to recognize the signs and symptoms of hypoglycemia. I will tell the patient that hypoglycemic episodes are often caused by diet-related factors such as missing a meal or not eating enough carbohydrates. Therefore, I will emphasize the importance of eating with regular meals and discuss the daily recommended amount of carbohydrate. I will tell her to observe for symptoms such as excessive sweating, feeling faint, lightheaded, blurred vision, new confusion, and or nausea, and to call 999 if she experiences any of them. I will instruct the patient to inform friends and family that if ever she appears confused or loses consciousness, she may be having a hypoglycemic episode and will need emergency medical help by calling 999. I will inform the patient that an episode of acute illness may cause irregularities in blood glucose, so she will need to monitor her blood sugar level more frequently and report any changes. And just like that, we are now finished with our evidence-based practice regarding diabetes. I hope you learned something for today. If you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. Comment down below what other Osce videos you want me to do next. Thank you so much for watching. This has been nurseniezl. See you on the next one. Bye! Now we are down to our shoutout section. I would like to greet a happy congratulations to everyone who passed their Osce recently. At Ate Rata 4213, congratulations for passing the Osce exam. Likewise to at Lee Jiza, welcome to the register. Last but not the least, I have got here at Mide T. Congratulations. Shout out also to our new member, Erlina Avasenya. Likewise goes to, oh my god, this is a difficult name, Ogalieg Bulim Asihinta. I hope I say it right. We've got Ira Alfane, welcome to the team. And hello to Krishma Tamang. Thank you very much for supporting my channel and welcome to the team.